you, everyone. So we would like to say welcome to you at this time. We are about to start the tips for challenging times. Well, child checkups, are they safe during the pandemic? And we have with us today, we're sponsored by Clues, Help Me Grow, and Ramsey County Early Childhood Initiative, and Minnesota Act Early. I'm Nancy Lee. I am your moderator for today. What I'd like to first of all say, this discussion is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and does not constitute medical or professional advice. Always seek the advice of your physician or other qualified health professional with any questions for your family's concerns. So now I'm pleased to introduce our panelists. This discussion, first we have Dr. Sylvia Sekhon. She grew up in Ramsey County before attending medical school and taught English for 3 years at a West Philadelphia high school. While there, she learned a lot about poverty, racism, gangs, and school failure. And through this experience, she recognized that these societal issues meant that you needed to start with children at a young age to help create a positive impact on their later life, and particularly to decrease racial, educational, and health disparities. That also spurred Dr. Sylvia to work in the field of child development. After medical school and residency here in Minnesota, she did a fellowship at Yale in Child Psychology Division for Pediatrics to get more mental health training. And she recently retired from Health Partners Como Clinic, which serves a diverse mixture of ethnicities and races and cultures, where she practiced for 30 years. Also next, Dr. Leann West has been practicing general pediatrics for 26 years. Hi, Leann. She's currently seeing patients at Mendakota Pediatrics in West St. Paul. And finally, we have Zang Vang Lee. She's a mother of 3 beautiful children, Aiden, Tristan, and Lana. She has a great passion for children and has worked in the early learning field for over 10 years. Zang advocates for children and families and is inspired by the assets and experiences that families bring to the community. She's also part of the leadership team of the Hmong Early Childhood Coalition. So we are pleased to have everyone here today for this discussion. And I am going to move right into our discussion and ask Dr. Leann to tell us some of your initial thoughts about medical concerns that might be at the forefront of a parent's mind right now.
Yeah, I think, the primary concern parents are voicing to me these days is, how do I keep my children safe from the coronavirus or COVID virus? And in expanding on that too, many families are worried also about the other generations of their family, keeping their grandparents safe and other family members that are involved in the care of their children. In addition, families are asking signs and symptoms. How do I know if my child has the virus? What do I do if my child gets the virus? And many of those, just new concerns that we haven't really had to even address before.
Okay. So when you think about that, Dr. Sylvia, would you speak to the ways to stimulate development and build resilience during these challenging times?
So this is a very challenging time for families, our community, and our nation, as well as the whole world. What is resilience? Resilience is the ability to recover. from some of the challenges people are facing now. Think about it as being able to bounce back emotionally, bounce back physically from hard times. And the most important predictor of resilience is social connectedness. That means from birth to 5, family, siblings, parents, grandparents. And if you have people around who can help a child come back to a normal emotional state by saying, you're going to be okay, that gives the child a sense of comfort and confidence that things are going to be better. One of the methods that many families and mental health professionals recommend are stories of family origin, family immigration stories, families who have suffered losses, deaths, incarcerations, other kinds of things, how the family overcame hard times. Because that gives a child a real sense of, I'm connected to people who are going to be okay, all right? And then the story, whether it's the family story or a made-up story or a book that you might be reading to a child, helps the child imagine a different future for themselves, that they can change their situation by the language that they talk to themselves with in their head. And so these are very simple tools. You don't need a TV or a smartphone. You need connected family members to help build resilience.
Excellent. Thank you for those introductory remarks. Because yes, we are in a time when there is so much that's going on, whether it's the pandemic, whether it's the concerns for issues around police brutality, trauma, that's affecting all of our families in some way. So it's an excellent point to remember the issue of resilience, the issue of how this affects development. Zang, share with us, some of your thoughts here and what this has brought up for you.
Yes, so I have 3 kids, and we, they went from spring break straight to distance learning. So it's been really tough for them socially. They're ready to go back to school, and for me, I'm thinking about fall for them, and I'm kind of worried. I would like to choose distance learning, but I want them to be able to have the option to go back to school and social with their friends. But I am concerned. So right now I'm kind of torn, trying to decide what's best for them, but also, and keeping their feelings and thoughts and their wants also in mind. So that's kind of, for me, in my experience with my little ones. Well, they're not little anymore. I have 2 teenagers. They're all teenagers now.
Wow.
But I think that my story is, I think it's similar with other families that I have talked to. I think we have families who are worried about what school is going to look like in the fall, distance learning, or if it's a hybrid or in person. So in our district, we have a choice to do hybrid. And that's what I'm kind of going back and forth on.
Okay. Zang, when you think about then, getting children ready for school, what question have you heard from parents that might be of importance to them?
I guess one question would be, how are the kids, how are the preparing a safe safe environment for the kids when they're returning. That is definitely one question that I heard families ask and wonder about or have concerns about.
Maybe Dr. Leann, is that something you can answer for us?
Yeah, so I've been hearing a lot of those same kind of concerns, and similar to what Zang is talking about, with families having to make a decision whether their children will go back to the classroom and whether their children will distance learn, all while not really having any information or much information from the schools about what their plans are for keeping the children distanced, keeping the children masked, and what that's going to, what the classroom setting is going to look like. Likewise, kids are then questioning, do I want to be back at school, or is it easier for me to stay home? I miss my friends. But if we have to be there with all these restrictions, is that going to be as much fun as I think it's going to be? And so, I think there's lots and lots of questions out there, and probably one of the hardest parts for families right now is there are so little answers, or the answers are trickling in at a slower rate than we need to be making those decisions that can be impacting the next, 6 to 9 months of schooling. So, I'm trying to give parents reassurance that, this is a moving target, and what happens in September may end up being something very different in November or December. And we just right now are looking to the expertise of our, the Department of Health, the CDC, the people who are creating these guidelines for us. And also encouraging families to take into account what's best for their family. And again, if grandparents are the primary source of childcare or after school care, then that may be a different risk factor for you than a family who parents are able to be home when the children are home. And, again, just trying to provide lots of reassurance and helping families find resources through the Department of Health and through the CDC.
Okay. What about I heard something in the question too. How about when it comes to the well child checkup? What's happening there to get the children prepared for school?
So we're very much encouraging families to come in for well child checkups. Certainly at those visits, we're screening for mental health concerns, anxiety concerns, depression concerns that children may be experiencing, and helping them find resources to be addressing that as best we can. In addition, it's, with the distance learning in the spring, some children did well with that, and some children that was a real struggle for them. And so helping those children understand that there's lots of other kids who are in that same position, as well as helping those kids understand that but their experience, they can be learning off of that experience now. If you found out that you worked better in the afternoon, then maybe using that, information now will help you get off to a better start as the school year starts. At the well child visits, we're, obviously doing physical exams that we can't do virtually. Listening to hearts, looking at ears, and checking, dental, dentistry and stuff. And so doing things that can't be done outside, and reassuring that yes, you are healthy, and being at school is something that you can be doing too, and helping to reassure kids that way.
Well, I know you shared with us what it might look like for a well child checkup. Could I share some of that
Yes,
with the audience?
absolutely. So some things we're doing in the office to make it safe for families to be here. We're trying to make it so that children that are sick are kept separated as much as possible from children who are well. At our office, we have kind of an advantage of, there we go, of having two doors into the lobby. So we have one door where children who are coming in for their well visits can come in, and a separate entrance for kids who are having respiratory symptoms, so that then they're not intermingling. We have lots of reminders to keep your mask on, whether you're here for a sick visit or a well visit, and reminders to wash hands, and have hand sanitizer available for families. Let's see, Nancy, can you help me get to the next slide?
Okay. Let's see here.
So when you get into the lobby, our front desk, we have hand sanitizer available. We have, plexiglass screens up at the desk so that there's minimal contact, between the staff and the patients coming in. We're doing lots and lots of sanitizing with between every visit. Anytime a pen is held, it goes into the dirty pen box and gets cleaned before it's ever used again. Likewise with we have laminated questionnaires and clipboards and things we use. Everybody who comes into the office is getting a screening questions about any COVID symptoms they may have, so that then anyone who has symptoms can be redirected to rooms that we have reserved for sick patients. Next slide, please. Our lobby is set up with a barrier. It's not the prettiest thing, but it's a plastic barrier between those seating that's available for well children and their families that might be waiting to get into a room, as well as seating on the other side for sick children. Honestly, the number of sick children we're seeing right now has been pretty minimal. And so those well visit rooms are getting a lot of use in that well visit side. We've taken away kind of magazines and things like that would be places where people might be touching and then setting down for somebody else to pick up. And then we have a sink available for hand washing, a private restroom that we clean between uses, so that people aren't using the public restroom in the hall and can feel safer too. Then we get into the exam rooms. You can see our lovely nurses are all wearing masks throughout the visit. Again, in the rooms, we're doing complete sanitizing of tabletops, exam tables, and any of the tools and things we use, including the blood pressure cuff that you're seeing the nurse setting up there. And then during the visits, patients and their parents and all of the staff are wearing their masks. The equipment that patients use, such as the little glasses for doing the vision screening and the earphones for doing the hearing screening, and glasses for the vision screening, pardon me, are all sanitized between uses also. And then patients who are needing to have COVID testing or who are sick, if they're not having breathing problems that we feel like need to be addressed in the office, or sore throats that might need to be checked, we're actually doing that testing out in the parking lot and in their car, so that, again, we have as few people with respiratory symptoms coming into the office as possible. When staff are doing that COVID testing, they're wearing the full protective gear, whereas for the well visits, that's not necessary and might be more frightening or more worrisome for the kids. And then when we are seeing sick children in the office, they're being put in rooms that are reserved only for those respiratory illnesses, and those rooms then get closed off and sanitized for at least 30 minutes after those visits. So, and that's been, a CDC guideline that's been set.
Great. I think that was your last slide.
Yes, it is. Yes.
No, okay. Thanks for walking us through that. I mean, it's really nice to see what the protocols are. I understand that, each clinic will have it slightly
right. Every
different.
office isn't going to have those, same things set up, but, many of those things children will be seeing at their visits.
Mm-hmm. Okay. Zang, did I see you?
Yeah, I have a question, Dr. Leann. What if families want to delay, can they delay their well child check?
Well,
And how do you explain that to families?
for
That's
younger
still
children, it's not
important
advisable to delay those visits because, you know, there's so much development goes on between birth and 5, and those are really key years for addressing any concerns early on. Children are, you know, at every well visit, we're having them do their ages and stages, a developmental questionnaire, and those are, you know, ways that we can be monitoring children's development. And again, catching concerns early and making referrals as needed to help me grow in the school district. Older children, we would like to make sure that they're keeping up with immunizations. And also, like I was talking about earlier, we are screening for mental health concerns such as anxiety and things like that. So again, those are problems that are caught early, have a much better outcome and much easier to be taken care of. I think, you know, teenagers are struggling a lot these days with the lack of social contact with their friends. You know, video is nice, phones are nice, but you know, that kind of one-on-one, that personal encounters are really something they're missing, and something that we, you know, also have a chance to talk about. Is this affecting you a little bit, a lot? Is this really impacting your ability to do things like sleep well, eat well, and focus on things you need to focus on?
Nancy,
Dr. Sylvia, what do you think in regards to preparation for the well child checkup and things that parents should think about?
Well, we had a couple of questions. I didn't know if you saw them, but I think we should address those as we go along so they don't build up.
Thank you for helping me out. Since you're right in there, can you quickly call out one of the questions? Thank you so much.
Well, Carmen Jansky had a question. It was about the long-term effects of the social isolation. And this ties back to my topic about resilience and social connectedness. And when this first started at the end of March, when we all had to stay home, I personally tapped into my parents' stories. My father went through the influenza epidemic of 1918, 1919, and told stories about that. My parents went through the Great Depression. They went through World War II, and they had shared all of those stories about what it was like for them and how hard it was, and some of the things they felt they had sort of missed out on. But I pointed out to them by the time I was old enough to make that connection, hey, but we made it. We made it. That was the important thing. And so the social isolation, you can use our imagination and read, listen to music, make up stories. When my grandchildren were little, 3, 4, and 5, I made up a bedtime story for them based on superheroes. And they were twins, a boy and a girl. So Grandpa went off with the boy, and they flew around in their capes. And the little girl and I, we had magic shoes that sprouted wings, and we flew around, and we vanquished the forces of evil, and we always prevailed in the end. And those were bedtime stories that they absolutely love. So you can use your internal resources to help with some of the social isolation issues. And a child needs 1 or 2 really solid, loving people in their world, and they will be fine.
As we think about this, Zang, I know that you had, talked about how you work with the Hmong Early Childhood Initiative. Tell us a little bit about what some concerns might be in the Hmong culture.
Let me think about that. Around in terms of well child check.
Yes, and
And COVID.
Mhm.
You know, what I have experienced or heard from families are just, just the same things that we've talked about, like how do we keep our families safe when we're going into clinics. Some families are not bringing or going to the clinics because they don't feel safe to go at this time. Otherwise, I think there are families, especially the younger parents these days, that are pretty up to date with their well child checks. And I think a lot of it is just informing them about kind of like the importance of it and what it all entails.
Mhm.
Those are some of the things. And I think also, just COVID and distance learning, and for our young kids, we have to consider the whole family, because it's affecting the kids, but also on the parents as well, because they are really teachers also, and also working, kind of like battling daycare and all the kids and their families. You might have 2 kids to 10 kids. So not just social emotional for just the kids, but for the entire family. Like, how do we maybe the doctors support the whole family, so that the kids are well.
Mhm. So I'd like to mention that we've had a couple of questions about immunizations.
Yes.
I can speak to the Health Partners clinics in the lobby. They'll have a TV scroll screen, and they keep flashing up there, make your well child visit and get your children caught up on their immunizations. I can't speak to the other health plans or organizations in the community. Leann, maybe you could.
Yeah, I kind of know what we're doing here, which is, when families are here, speaking to them about the importance of keeping the immunizations up to date, and helping families who have fallen behind schedule those nurse visits or additional visits that may be needed to help children catch up. We are sending out emails reminding families to go to their well visits, and including in that to stay on the immunization schedule. So doing, what we can, the kids have to be here, so doing what we can to get them in here to get those visits and immunizations taken care of.
And I know that Ramsey County Child and Teen Checkup does a lot of that outreach to
Yes.
remind families about the well child checkups, because there are a lot of them depending on the age group.
Yeah.
And if there's the need for specialized care, they also make sure that they help support a family to get to that. I'd like to read off a comment that did come in from Dana. It says children are also screened for lead poisoning at their well child checkup.
Yes.
This screening is really important to make sure lead hazards can be addressed before they become a bigger problem, because children are spending more time at home due to the pandemic. They could be more exposed to lead hazards in the paint of older homes. And so that leads me to a question, how are the well child checkups addressing racial health disparities overall?
It's certainly, something that's coming up in families, something that families bring up, as well as something that we're trying to address by helping families find books and literature and things like that they can use to be discussing this more with their, the social and racial disparities with their children. in an age-appropriate way. You know, certainly again, by getting children into the office, we can help with their, talk about their, you know, environment, health environment and that sort of thing too. Oh, I don't know, Sylvia, do you have more to?
Well, had several families from the Dayton's Bluff area that tested positive for lead. And so I would always look at where people lived because, of course, I practiced in St. Paul. So I knew St. Paul pretty well and Ramsey County pretty well. And so if someone had an address over on the east side, I would try to pinpoint exactly where that was, even if it was a 3 or 4-year-old who had had negative lead in the past. I would, because they were home more now, I would ask, well, we can always do this again. We will do it anytime you ask for it. The lead testing is just a tiny little drop of blood. It's not a painful blood draw, and it could make a big difference for the whole family.
And I think, you know, by having continual reminders for families of the different racial, ethnic, and cultural groups, we also provide them greater access to getting into the clinics and reminding them that the clinics are there to help the child improve their health, support their healthiness. So I think that's an important thing. I see oh, go ahead, Zang.
You mentioning, like, you know, we encourage families to go into the clinics and get their well child checks. What about families who don't have health insurance? Are they, where can they get their well child checks? Are there resources for families?
So the community health centers throughout Ramsey County and Dakota County are able to, and Hennepin, are able to take people on a fee-for-service basis, and often, you know, based on income, that care is free. We always encourage families to look at whether or not, because many families who qualify for medical assistance don't realize they qualify for medical assistance. So looking into the resources that are available through the state also. But the community health centers are a good resource for that care at times when your families are without health insurance or coverage.
And again, in each county, in the public health department, especially with the child and teen checkups, they can help connect people to the needed healthcare resources based on income eligibility. They'll help get them set up. So that's a place to get support. Sylvia, it looked like you were going to share something.
I was reading Rochelle Underwood's comments.
Okay.
The first one being about asthma, because parents are so stressed during this time. They talked about the incidence of alcohol consumption going up, and I'm sure some people slipped back and started smoking again. And of course, that's because of the particles from the cigarette smoke getting in the lungs of the smoker and secondhand smoke for the children. That has a huge impact on lung health now and in the future. And then there are resources for adults for smoking cessation, phone coaching to get people to stay on track about giving up the cigarettes.
Well, one of the things I think about is the idea that all of us are having difficulty getting into our clinics. So it's really important, I think, that doctors think more about having the pregnant women have accessibility to appointments more readily, rather than saying, oh, we'll wait. Because if you have a high-risk pregnancy, that kind of causes a bit of a problem. We're getting near to the end of our time. And I would like to encourage everyone to take a look at the chat box, because we have some wonderful sets of information, resources that people are sharing. The CDC Act Early website offers free materials in both English and Spanish. The developmental milestone tracker is really useful and can be helpful to your children's pediatrician during their well child visits. You can find those things on the Help Me Grow and the Minnesota Act Early website. We'll also have some in Spanish that we can send out to you. Giving just about a minute for each of you major presenters to just share some last thought with us, starting with Dr. Leann. What last comment might you have?
Yeah, so I am seeing in the chat some discussion about asthma and being, kids more at risk right now. And again, another reason to be coming into well visits, those kind of chronic health problems like asthma and ADHD can all be addressed also at well visits. Most doctors are very willing and want to, incorporate that into the well visit. I've also kind of my final plug is I've been reminding families we need to be getting outside. Kids need to be getting outdoors to be seeing nature. And I think for everyone's mental health, getting that, sunshine and green space experience is really important.
Yep. Zang, what might you say?
Go ahead, Zang.
I'm looking at the chat and I'm just glad to see that there are services or organizations still open for families. I think during these times, we're not sure what kind of services are available, whether, there are safe environments. And so it's good to see that there are organizations open still to support families, whether that's limited service or not. I just encourage families who may have concerns about their child's development to contact the organizations, connect with their doctors, or services such as Help Me Grow. I see Diva Mom on here. I've heard their presentation. It's sounds like a really wonderful program too. So
Diva Mom specializes in Black moms and supporting them and offering events. So I've enjoyed going to some of those as well. Sylvia, any last comment? Well, you've got about 30 seconds.
We don't need high tech. We don't need computers. We don't need smartphones. We need engaged parents who talk, sing, read, and play with their kids. Simple things like an egg carton or a cardboard box. Cardboard box can become a rocket ship, and you can go off into space and have wonderful adventures. And suddenly it's time for nap. So let's be creative and not spend lots of money on things that are not necessary.
Mm-hmm. Thank you. Thank you for that roundup. Thank you, everyone. Have a great day.